Good morning and welcome to DrayTek's Digital Social Care in the care home sector. So the introduction for today, this webinar is designed for those partners dealing with the care home sector and should last about 45 minutes, including questions. The webinar will be recorded and available on the dealer portal within the next 48 hours. This can then be shared with any of your colleagues. Please use the chat functionality on the GoToWebinar app to start sending your questions, and we will try aim to cover all of these questions by the end of the presentation. Anything that is not covered today, we will be in contact with you within the next 24 hours. My name is Shane, I'm the Proposition Manager, and I will be hosting today's session. Our presenter is Rupert Erskine, Channel Development Manager, and he will be running through the presentation. At the end of the session, we're going to have questions being read out by Alex Schuker, Technical Service and Product Manager, and answers are going to be from Mihai Krutu, which is your pre-sales engineer. So let's get started and pass you over to Rupert to continue with this presentation.
Well, good morning, everyone. Thank you for joining us this morning on this care home webinar. Just like to sort of make a couple of pledges to you guys with this presentation. Is that, well, hopefully by the end of the presentation you'll see the commercial benefits of DrayTek within the care home, but also from a technical perspective. Hopefully you'll come away thinking, oh, I didn't know that product did that, or that could help here, or that product could solve a problem here. So those are some couple of pledges we'd like to do. Obviously at the end there are some questions. Any question you have, please feel free to share. No question's a stupid question. Please add them as you go along. So the agenda, so the importance of care homes. So why care homes? Why is this discussion going on so much? And then if we open that a bit more, the challenges in the care home market itself, and then actually in the challenges in the care home. Then the digital social records, so some of the themes around that, what that means. And then finally at the end, so these are obviously the challenges, these are the problems, how DrayTek can support within a care home. And then there's Q&As as well, as sort of discussed before. The why care home. So as I sit here today at just past 10 on the 30th of November, there's about 18,000 care homes, and that simply isn't enough in the UK. There was a target set by the UK government in 2017 to have 71,000 care homes by 2025, and it looks like they're not going to hit that target. By all means, they're going to be quite far from it. But they need to keep growing. It unfortunately, whichever way you look at it, it's a growing market. Whether they build the amount in 2024, who knows? But we'll see. And just some backgrounds for me. We speak to nurse school providers all the time. They're working with M&E contractors, and I went to see one in July, and he just said, we're just so busy because we're just constantly looking at drawings with M&E contractors. They're just not building enough. Then obviously below that, so we've got require better connectivity. So within that, so that's whether it's the resident or the nurse requires better connectivity within the care home. There's also a task to have patient records digitalised by 2024. So there's aspiration that at least 80% of care homes by the end of March next year have patient records digitalised, so they can log, they can track. There's no need for pen and paper anymore, where things can be hard to read or can be scribbled down. And then finally, there is an ageing population in the UK. 25% of the UK is over 65 now. In the next 10 years, 25% of the UK population will be over 65. So that means there's going to be more and more pressure on care homes. And actually, if we look at the NHS now, when the NHS was formed in 1948, it was designed for immediate critical care. And what I mean by that is you go into hospital, I've broken my arm, I've broken my leg, I've had a heart attack, you name it, and the sort of the hospital would be able to deal with that now and now. The challenges now with illnesses, it's kind of like onset challenges. So being able to pick up onset dementia or onset Alzheimer's in your early 40s, that can actually prevent you from going into a care home in your mid 60s. So therefore, it's trying to stop the backlog. But unfortunately, with sort of the challenges around the NHS at the moment, these sort of illnesses aren't being tracked early enough, and therefore there is a sort of a backlog building up at care homes. I was at a care home event, I think last Friday, maybe the Friday before, and we were speaking to one of the nurses there who works there, and she's been working in care homes for 30 years. And I said, "What's changed? What are the challenges you had?" And he said, "Well, when I first started, we dealt with a care home that it was just one care home, but actually now we're managing 3 or 4 care home groups within our remit. You know, and in one care home it was 6 people we looked after. Now it's 30. You know, there's a kind of a constant backlog and pressure. So yeah, take home away from there, it's a growing market and it needs better connectivity. We'll delve deeper into those in the next slides. So the connectivity challenges, as I said on the last slide, so multiple devices per resident. So a resident now might have a phone, a tablet, they might have a medical device by their bed to look at their their vital signs to make sure they're okay. Within that as well, the challenge also for the care homes now is for the resident who goes in there. The objective for the resident is that when they go into a care home, is that they feel like they still have their independence. You know, they feel like they're being transitioned into a place that they can enjoy their retirement, enjoy their later days in life, and they don't feel like that they're being watched. But actually, the challenge is actually for the nurses in the care home to make sure they are being watched 24/7. So there are lots of multiple devices. There's also things like nurse call. So in the old days, a nurse call button would just be a hardwired button on the wall that you'd press, and that would push an alert out to staff. Now actually with the nurse call button, it's over IP. So what that means is you press a button, it goes to a control cabinet, then they can push out alerts to nurses who have hands devices, and that also all needs connectivity to do it. Varied building structures as well, so affecting signal strength. So again, so there are a lot of devices now for the residents to use. Within that, there is challenges getting the signals through the wall. So, you know, they press a button for assistance. It does, you know, they're trying to use their tablets, they're trying to use this, they're trying to use that. It doesn't work because the building walls are so thick. There's also a critical need for reliable connectivity for medical purposes. So again, a lot of staff and a lot of residents are being integrated into things like heart rate monitors and stuff like that that's on site. If a person goes into a crash, for example, if a resident goes into a crash, they need to have the alert, they need to have the connectivity. So there's the challenge there. If you wind it back a bit, because that's more seen in hospitals, but things like record keeping, so like there's applications out there like Norwich or PCS that log if the resident has had their medication. And me and Mihai, we went to a care home a couple of months ago, and there was a situation where a nurse was telling us that they couldn't get proper Wi-Fi on the device, and therefore they couldn't work out whether they gave the residents their medication for the morning or not. So they were stuck in a really challenging situation where they didn't know whether or not they gave the residents medication. So they had an option: do they risk not giving it to them, or do they double dose them? Again, this is a knock-on effect. These are the connectivity challenges that you have. You know, record keeping, so logged. Have you fed the residents? Have you turned over the residents? Have you got their information on them? Who to call? What to do? All this, because again, the other challenge you have in the care home now is there's just not enough staff. I don't know if you see on the news and that you know there is just not enough staff to look after a care home. So what that means again for the resident, for the nurses, instead of a nurse turn around and say, well, I can do 10 tasks in a day. They're actually asking them to do 20 tasks in a day. This is causing the nurse stress and challenges within that. So they need to kind of step back and think, right, well, how can we help that? How can we allow that nurse to do 20 tasks in the day more quickly, more accurately? They need solid software and connectivity to do this. Also, yeah, like I said earlier on, residents are becoming more tech savvy. So if you talk about sort of my personal sort of situation, my grandma was in a sort of care home over 10 years ago. And if I turned around to her and said, you know, Netflix, she would have said, oh, what's this? But actually now residents are coming into these places. They've left their homes that they've had for 30 or 40 or 50 years. They sit in these care homes and they ask a simple question like, oh, what's the Wi-Fi for the Netflix? They're saying, oh, we don't have Wi-Fi in here. So, oh, what do you mean? So then that's causing the resident disruption. They're not having a fantastic experience in the care home. And then the other challenge within that is that it's also causing a nurse stress because they're having to deal with this stressful situation that's kind of just building up over time. So those are some of the connectivity challenges. And then, like I said, with the care provider, the challenges there. So demand is rising for the care homes. Sort of like I said at the beginning, a nurse has been in a very simplistic situation. Has been asked to do 10 tasks in a day, but actually a nurse can only do 10 tasks in a day if they really push it. The care home group or their boss is asking them to do 20 tasks in a day. So that's the fatigue and stress, and they're thinking, we need to move on. There's also challenges within that, sort of booking in, residents when they move to a care home, logging them in. Right, have I got the residents' families' contact details? What medication do they have? What challenges? And it's all on pen and paper, so they need to be in a situation to digitalise that. There's limited working hours as well. If they can only do 10 tasks in a day, but they're asking to do 20 tasks, instead of doing an 8-hour shift, they're doing a 12-hour shift or a 16-hour shift. There's pressure from hospitals. Like I said at the beginning, the NHS is in a humongous backlog at the moment. So there's kind of pressure to get people out of the NHS, out of hospitals and into these care homes. And then also sort of structures within that. So as I said at the beginning, the digital social records. So they need it to be digitalized by 2024. I think there's a target to have 80%, if not more. So this is care record applications. So moving away from pen and paper. Obviously, the main benefit of moving away from pen and paper is to delimit errors. Reading people's handwritings. I mean, I've written down some notes for this presentation here, and I think if I passed that to anyone, they wouldn't be able to read or write it. So it's actually been able to log, minimizing errors. Obviously, a comprehensive view of every aspect of your service from the touch of your button. So there's a lot of applications out there now that you can log in and monitor, and you can sit there with the resident and say, oh, they like their breakfast at this time. They like this, they like that. Or don't give them food before 5 o'clock. This is their allergies, this is that. So it's obviously being able to give that resident a much better experience. But unfortunately, within that, there's poor Wi-Fi infrastructure. And what I mean by that is, again, I went to sort of a care home event in July, and we were speaking to people and saying, well, we need to do this digital social records, but the Wi-Fi we've got in these places is consumer-esque Wi-Fi, or we don't have Wi-Fi at all. So when we talk about consumer-esque Wi-Fi, we're talking about things that you might use at home, a broadband router that could serve 4 or 5 people in a family, and a couple of range extenders to give them Wi-Fi to the garden. Again, that's for 4 or 5 people, but when you're in a care home with 100 rooms or 200 rooms, that will not work. And therefore, that will slow down because these care records, these applications won't work. They can't use the nurse call. Things like fall detection and prevention applications out there won't work because they won't have enough coverage. So again, that means more work for the caregiver and the nurse, and a much worse experience for the resident. They're going from a situation where they feel like they've still got their independence, they're in a lovely room, they're seeing out their later years in life, going from that kind of experience to more, unfortunately, they will feel like a prison where they'll want to leave and not have as a good experience. So those are the challenges there. So we've obviously talked about the problem. We've talked about the backlog in the care home, not enough care homes within the care home itself, digitalising that workflow. So how can DrayTek help? How can we solve a problem? So these are sort of like the top levels, and we'll delve deeper into each one in a bit. But reliable and consistent Wi-Fi coverage. So we work with HC1. So they've got approximately 300 access points across multiple care home sites. So we have business grade Wi-Fi, which we'll touch upon, an easy central management and remote access. So that's the ability to manage the devices anywhere, anytime. So again, taking the pressure off the care home. They don't need to have an IT manager on site, or we're not turning around to a nurse and saying, look, a nurse, I know you've been a caregiver for the last 40 years as a nurse. We now need you to be an IT manager. We're not saying that. Obviously, with security features as well. So within these digital records, there's obviously very confidential advice on each resident. And we're saying we can give business or grade security features to protect that record, meaning that no information is hacked into by using business grade security firewall features. And we're looking to guarantee a site 99% uptime, 99% connectivity. Therefore, you can get on with giving the resident a really good experience, and therefore allowing that nurse to go from maybe doing 20 tasks in a day to doing, 10 tasks in a day to 20 tasks in a day more quickly, more accurately, and have all the evidence to back it up afterwards. So that's the solution. That's what we're looking to solve. These are just some more specific technical details which we'll go into. But actually, for products, these are the products and solutions here. So we've got obviously our accessories, but routers, access points, switches, and firewalls. So obviously the routers providing that site connectivity and giving a business grade router, which has failover. So if one line fails, you can flick over to the other. It also has an enhanced firewall to protect the security of that site. These are some of the access points here that allow us to extend the wireless coverage along various sites. And then switches here that the access points would plug into, but also be in a situation that you can have plug in software as well. So things like nurse call IP or PBXs or other sort of software applications on site. So like I said, so that's the overarching product. These are the products themselves. We'll delve deeper now into actual specific products themselves. So this is the 2866 LAC. Lots of letters and numbers there, lots of jargon down here. I won't go through each bit specifically, but the overarching theme of this product here is that we'll guarantee a site 99% connectivity. And we can do this very simply by having a DSL port. So that's for the old sort of traditional copper or telephone line that will go into a building. But we've also got 6 ports here. This one here is a dedicated WAN port, but we've also got one here that can be a WAN or a LAN port. So what that means is that you can have 2 WAN ports, which means if you've got 2 lease lines or gigabit lines going into the building, if one fails, you can flick over to the other seamlessly. So you're guaranteeing that site connectivity. The other great feature about this product is that we also got 4G and 5G. So I'm thinking about some of the care homes out there that might be in some sort of tricky places where they haven't even got a telephone line going to the premise. We're in the sort of the deepest, darkest countries in the UK. We can actually give the site connectivity. So we've got 3 options there. It can support up to 32 VPN tunnels, and it's got Wave 2 as well. So it's all the latest and greatest in terms of wireless. It also can use something called Vigo ACS, which I'll sort of touch upon in a couple of slides. But this is our flagship model. It's 4G, but we also have a 5G coming out in the new year as well. So this is our one of our sort of flagship 11AX products, the AP960C. As you can see, it's had some write-ups and some good rewards here from PC Pro and IT Pro. So we're in sort of good hands in terms of acknowledgement. What's so great about this product though, for the care home over other things, is it does mesh wireless as well as PoE. Mesh wireless is really, really helpful for care homes where, right, we need to put Wi-Fi in this room, but the resident there can't leave the room. They physically can't. So things like cabling and infrastructure and asking that resident to move out of the room and go into another room will be a real challenge for them. So we can turn around to the care and go, no worries, Mr. Customer. We can mesh. So that just literally plugs into a power socket. The only challenge with mesh is as you start to build up, if you have over maybe 2 or 3 access points, the wireless does get a bit weaker. But yeah, this does, it's wall ceiling mounted as well, and it's got a nice sort of slim sort of case around it. So it's got a sort of sleek design. So it's out of the way. It won't draw attention to the person or the resident or the nurse. And as I said, it's managed by ACS as well. I'll sort of touch upon ACS a bit later. In terms of a switch, this is our sort of flagship 24-port PoE a switch here. So it's got 24 ports of PoE, so you can plug devices into the back of it, plug access points, plug PBXs, plug other sort of on-site applications that require sort of PoE to run or IP. This is not the only one we do. We do an 8-port version as well, and we do unmanaged and switches with sort of layer 2 features. Okay, just move on. So this is our flagship firewall, the 3910. This is where if you're looking to add so you've done connectivity to a site, you've put a router in, you've put a switch, you've put a firewall, a switch and an access point on the site. You're starting to build up that network, and actually you need to share information from one care home to another to multiple care homes. We would recommend this device here to do this. One of the key sort of takeaways here is the 10 gig SFP ports here. So you can actually take 10 gigabit speeds and decouple them to multiple sites. And if you look at some of the throughputs down here in terms of IPsec, VPN performance and SSL. So yeah, this is a great one if you're starting to build up sites, managing multiple sites for a care home. This also does ACS, which I will now touch upon now. So ACS remote management, if we're talking about right at the beginning, the sort of the requirement for a care home to manage multiple sites, and actually for the care home itself, where they haven't got an IT manager on site, and the care home has got a nurse who doesn't know anything IT. You know, they've been a nurse for 30, 40 years. A lot of sites now turning around to be IT experts. We can take the pain away with ACS remote management. So that's the ability to manage routers, switches, firewalls on the site, anywhere, anytime. And what that means is for the nurse, if the Wi-Fi stops working, connectivity stops working to the site, a phone call can be made by the nurse to their IT provider, and they can ring up and say, our Wi-Fi is not working. Sure, no worries. Let me log in remotely and change that for you. So that also helps with those reduced tech call outs and time. You know, in the old days, they'd ring up, our Wi-Fi is not working. Where are you based? Oh, we're based in Manchester. Well, I'm in Reading, so we'll have to drive to site. So it'll take 4 or 5 hours to get there. It could take a couple of days if they're busy on other things. But with ACS, it's that actual ability to log in remotely and sort their issues there and then. So you can really guarantee that site 99% connectivity. We can do provisioning, so equipment can be shipped to site in an almost plug and play scenario. Doesn't require necessarily an IT engineer to be on site. Like I said, we can monitor. We can also do things like diagnostics and support. So, room, on the ground floor, there's a lot of applications, a lot of devices being used. Therefore, we can prioritize the bandwidth to that ground floor. We can also do alerts as well. So if an access point or a device goes down, we can actually be in a situation where we can be alerted before the care home. So if the care home rings up a person and says, we haven't got any Wi-Fi, they actually get, no worries, we're already on it. We know before the nurse or a situation arises. So again, we're really focusing on that 99% connectivity, helping digitalize that care home to guarantee them site. We can also do scheduled maintenance, so that allows the access point, the switch, the firewall to have a real seamless experience. So we can choose when to do that as well. And yeah, like I said, we can also send monthly reports to the care home, so they get a good, they can review, applications or devices are being used quite a lot on this floor. Maybe want to review. Oh, okay, you want to add another floor or another corridor, another site. Well, you might need some extra access points and whatnot. So, can really be an experience to that care home. So they can really help with their digital transformation, saving that nurse time and giving that resident a much better experience. So this is a sort of a nice write-up by one of our partners. So this is Andrew Ellingham at First Call Com. He's working with quite a few care homes in the UK, some sort of well-known care home groups. What was Andrew got to say? So we've been working with DrayTek for many years. The end-to-end solution of routers, switches, and AP addresses numerous challenges for the care home. It always allows the care home to always have great connectivity and wireless coverage throughout the care home, and also has the added benefit of content filtering to block access to certain websites. Yeah, again, I'll sort of touch upon that at the end. Their support team's always on hand to help. We even come to site to the care home if they're having issues. Also, we can deal register all opportunities of peace of mind that our margin opportunities are protected. Yeah, so just so from a partner's perspective, we can deal reg. So if you go to a care home, if you scope out a solution, we can protect you, we can reward you because you've got the relationship with the care home itself. You've built up that experience. You've done the legwork for us. You can therefore allow that nurse and the care home to have a really good digitalization experience. And at the same time know that the opportunity is locked in. So to touch upon that content filtering as well, so we can block certain websites from a resident from looking at, and the same with a nurse as well, so they can again have a real control and autonomy of what the site are looking at any time. So yeah, ensuring a smooth translation, comprehensive installation process. We can give training for care home staff. We've got a UK-based support team, so any problems, you can ring up someone, get straight through. I'll share my details at the end. So if there are any challenges with creating tickets and stuff, you can just pick up the phone to me and we can help support that. We've also got pre-sale support. So like I said, me and Mihai, we've been going to care homes themselves. We've been able to give advice and say, look, these are where your challenges are. This is how we can solve them. This is the solution to do that. And then actually for the partner themselves, we can give some healthy margin and deal registration. And yeah, so this is how you can reach out for a demo consultation. So these are the email addresses here. We can also do help with timeline and installations. And if anything of today, if okay, that's quite interesting, we can delve a bit deeper. Mihai is on the call, does a number of webinar sessions on ACS that obviously look a lot more specifically and a lot more granular detail on how they can be set up.
Well, thank you
And
very
that's
much, Rupert. That was very insightful. I actually didn't realize how many applications are actually required in a care home. And I think that's some real valuable insight for anybody that's going to be entering the sector. I would like to now pass you over to Alex and Mihai, who's been answering some questions during the course of today's session. Please feel free to keep on populating some questions into the chat box, but let's see what we have available. Alex and Mihai, I'm going to be passing this over to you.
Thank you, Shane. Hello, everyone. Yes, so thank you very much for everyone who's asked the questions directly. We've got back to everyone over the chat, but now we're going to pick some of the questions to answer over the audio. You're welcome to continue answering questions. We'll be able to answer that over the chat as well, and also do some of those over the audio. But we'll start off with a couple of the questions that have been asked already. So the first one is related to the recording. Will there be a recording available of this webinar?
First of all, a very good morning to everybody. Yes, so indeed, there will be a recording available on draytek.co.uk. So in a couple of days, if you come back to our website, you should be able to find it under the videos section. Alex?
Thank you, Mihai. Next is a technical question. It's asking about being able to separate the network. So if you've got a corporate and also running guest Wi-Fi, how easy is it to separate those two wireless networks? And is the VLAN setup complicated?
Well, I wouldn't say the VLAN setup is complicated. That's quite a basic setup that you must perform. And generally speaking, from a DrayTek point of view, creating two separate networks to accommodate a guest and a main Wi-Fi network is quite easy to achieve. And also, going back to draytek.co.uk, there are plenty of guides on how to achieve this. I suspect we will be able to post a link later in here. Okay, Alex?
Thank you. And next question is about kind of restricting content for guests. Is it possible to restrict unsuitable content on the network?
That's a very good question indeed. So in here you have two options, either URL filtering or web content filtering. The latter one, it's a subscription-based solution, and indeed you can block entire domains, such as gambling, for instance, which is unsuitable for children, uh, or uh, adult content, again unsuitable for children. So all these websites can be automatically blocked by using the URL reputation web content filtering.
Thank you, Mihai. That's a separate license that can be purchased separately, and it's something that it applies to each router. So if you've got multiple access points, they'd all be using the router to drive the content filtering. So you just would need one license per router that you have, where you want to do the filtering. Now, a question about wireless and kind of touching on, I think, some of the stuff that Rupert asked, well, mentioned about people using devices to enter kind of medical records and updates and things related to um, the people who have been given the care. So the question is, can tablets easily roam as they move around a property, and also kind of related to this is to do with mesh. Is mesh the DrayTek mesh function needed for this roaming?
Yeah, that's another very good question, Alex. Indeed, uh, you don't need mesh for the roaming process to happen. Mesh, in my opinion, is not a solution. It's just a workaround to a problem you have on site, and that problem is the fact that you can't really lay or you can't wire the access points into the network, and therefore you go to the next best thing, which is a mesh solution. Uh, but you don't really need a mesh for the roaming process to work. A DrayTek access point, also a DrayTek router, supports even the industry standards such as 802.11r, which is the fast roaming transition, or enterprise roaming, which is 802.11x, and some proprietary roaming solutions as well, such as AP assistant client roaming, which works both for a non-wired or a wired network. Just to keep it simple, yeah, you don't need Bash to actually use the roaming process. Alex?
Okay, thank you very much, Miha. I now have actually this is a sales related question. It's come up. It's about the deal registration. I think maybe if Rupert, would you be able to kind of just cover some stuff on how people do deal reg and what are the kind of minimum criteria in kind of like minimum size for doing deal registration?
Yes, certainly. So for deal registration, we will need the care home as end users, so their care home name and a contact detail for the person on site. And then the minimum order value will need to be £5,000 of DrayTek equipment, or it needs to be 30 units of one specific product. So that's what we need. And then we give you, in return for that deal registration, we give you some more discounts in return. So therefore, that's now locked into you. And then if another reseller came along and said, "Oh, we've got this opportunity," we turn around to them and say, "Sorry, Mr. Reseller, that's already been locked into this specific care home." The only time we would open up that that quote or that deal to another reseller is if the end user or the customer specifically requests it. You know, we need a few quotes for our procurement perspective, but in return, we would only do that if we have an email from the end user or the care home in this specific example saying that, because and would need an email from them to say to us, because then we can then share, you know, the reseller who we deal registered comes to us and says, "Oh, why are you giving everyone else a quote? I thought we deal registered." We say, "Well, sorry, Mr. Customer, the end user or the care home has specifically asked us to. Here's the email to show the evidence."
Thank you. And there's been a follow-up question related to that. It's about kind of how long would a registration be valid for?
Oh, that's a good question. So
I think it might be 30 days, isn't it?
30 days. But again, you know, we do it on a case-by-case basis. It'd be good to understand, you know, if it's a new care home being built, when's it being built, what time will the care home launch, what's the rollout, has the care home got budget, has it got sign off, what's the problem they're looking to solve, what's the requirement. But yeah, generally as a rule 30 days, but we can extend that on a case-by-case basis.
Okay, thank you. And now we've got looking through, we've got another technical question which is related to the mobile broadband. So the question is that you showed a Vigor 2866 model and talked about the failover with mobile broadband. The question is every model in the range capable of supporting the mobile broadband, or is it specific models?
Yes, so yes and no. I would say all models would support somehow, one way or another, mobile broadband. But what Rupert showed us just a few moments ago was a 2865 LAC. And part of that termination, it's an L and an AC. So L stands for LTE, and AC stands for the wireless standard that router supports. So when we look at a model that has an L embedded into its name, that means it also has an LTE modem embedded into the box. If that's not the case, then you might want to use a dongle and then an LTE dongle and then plug it into the available USB port. I hope that's clear enough.
you very much. Yeah, when you mentioned about all of them supporting it, I think you're referring to the USB port where someone could plug in a separate
Indeed.
USB dongle, which it's got really reason-wide support of most dongles, but do check on the compatibility list for support if you've got a specific dongle, because there are quite a few out there, but we generally have been able to add support for newer USB dongles if you have a specific one that's new, but the easiest way is with the built-in SIM, because you've got the SIM slot, so it makes it a lot easier and less to lose as well, because you don't have the problem with the USB dongle disappearing when you need it. So thank you, Mihai. Now a question about provisioning. The question is, so provisioning is a term that where you have a unit that is sent to site and turned on and then logs into the ViGrAssist system, and then the ViGrAssist system can provision settings and site-specific config to it. And the question here is, does it do it via the MAC address? How does it identify the device?
Well, yeah. It can do it via the MAC address. There are many ways in which you can actually use provisioning on our management platform. One of which is by identifying the MAC address. So let's assume you have a specific configuration for a particular router or access point that's already sitting on the management platform and waiting for that device to register. As soon as that device it's online and registers on the platform, the ACS is going to recognize the MAC address, and therefore it's going to provision the correct parameters to that device. That's one way of achieving things. Another way of doing it is by just ignoring the MAC address component and just apply a global profile. So any device that registers on the platform can pick up a set of parameters or configuration, if you'd like. But yeah, I hope that's clear enough.
Thank you very much on that. I think we have got looking at the time. I think we can probably wrap up there. Thank you very much for asking all the questions. There's a couple more specific ones that we'll get to people, I think, directly. But I'd just like to thank Shane and Rupert for the good presentation. And thank you all for attending. We hope you found it useful. So do give us feedback afterwards. There's at the end of the webinar, there's a survey. You've got an opportunity there also to include any topics that you'd like us to host in the future. So thank you very much.
Have a lovely day. Bye.
Cheers, guys. Bye.
Thank you.